Hello and welcome. I have the distinct honor to introduce you to two of the nation's top spinal specialists who often collaborate together in leading and pioneering the most advanced non-operative and operative treatments. So please help me welcome Dr. Colin Haines, a spine surgeon and director of research, as well as Dr. Nitish Bharara, a non-operative specialist and director of regenerative medicine, both at the Virginia Spine Institute. Thank you, gentlemen, for joining us today. I'd like to start with Dr. Haines. As a spine surgeon, do you always recommend surgery?
I certainly do not. So it's rare, if ever, that I meet someone for the first time and recommend surgery. And this is for two major reasons. First off, 9 out of 10 patients with spinal problems get better without needing surgery. Now, there's a variety of treatments that can get patients back to their functionality and get them pain-free, spanning the gamut from physical therapy to medications, sometimes needing injections, sometimes regenerative medicine, and occasionally surgery is needed. But the vast majority of the times, patients are able to get back to 100% enjoying everything they want to do in life without needing surgery. Another major reason that I don't recommend, in general, recommend surgery the first time I meet someone is simply because the spine has a lot of thinking that goes along with it. It's rare, if ever, that I see someone for the first time and know everything that's going on with their spine without needing to do another test, trying an injection, or trying some of the physical therapy that would give me enough knowledge to know exactly how to surgically treat their spine.
Thank you. That's very powerful and intriguing to hear coming from a spine surgeon. Dr. Bharara, you've recently been named the face of regenerative medicine by Washingtonian Magazine. What are some common myths and understandings you can share with the audience around what regenerative medicine is for the spine?
Sure. So non-operative care in the spine is really a spectrum of care. So it starts with physical therapy and can progress all the way to surgery. And so if you do physical therapy and you may not improve with physical therapy, there are other treatments like traditional non-operative care, like steroid injections and that sort of thing. And sometimes that's what you need to get better and treat the symptoms. And then you have regenerative medicine, which kind of bridges the gap between traditional non-operative care and spine surgery. And so the term regenerative medicine is used a lot. And most people don't understand what regenerative medicine is. And it's pretty simple. It's really just the science of healing a damaged tissue naturally. So you're replacing damaged tissue with something that's well healed and that's functional. And so regenerative medicine is a very important part of the non-operative side of treatments. And in the spine, we see non-operative care as a palliative method, because traditional non-operative care with steroid injections really treat inflammation. With regenerative medicine and trying to heal the problem, we use different treatments like stem cell injections, which allow you to place stem cells in an area and allow them to differentiate or turn into the type of cells you want to create. Or we use platelet-rich plasma, or PRP. These are treatments that many of you have heard of, and these are placing growth factors and enhancing the environment to actually re-heal. And then there's other treatments like prolotherapy, which also stimulates the healing process. And so depending on the pathology that you have, depending on the disease state that you have, I think it's very important that we consider regenerative medicine options. And one of the main issues that we see in spine-related disease is degenerative disc disease. And one of the main problems that we have is that we're unable to treat degenerative disc disease very well, non-operatively. And one of the things that we have seen is the use of regenerative medicine in the disc has allowed us to, one, stop disc-related pain and improve the stability of the spine by treating the disc.
Thank you. As a spine surgeon and a non-operative specialist, can you both speak on any case examples that maybe have worked with regenerative therapies or some that perhaps have not?
Sure. So this is a very broad and a very appropriate question for this panel, simply because once upon a time, if you had a painful degenerative disc, painful arthritis in the back, the only option was either you live with it or you get surgery. Well, regenerative medicine is this huge area that bridges that gap, as Dr. Bharara was telling us about. So we get this question day in and day out. When would a regenerative medicine option be a more appropriate treatment for me, or when would a surgery be a more appropriate treatment for me? In general, if we've gotten to the point where all our routine non-operative treatments have not worked and the patient still has debilitating back pain that's not responding, surgery is oftentimes suggested in situations where the spine has poor alignment. So some of the things that we hear about scoliosis, or when the spine has an S-shaped curve to it, or a term called spondylolisthesis, which is just a big fancy term for meaning the discs themselves are moving around more than they should. When the spine is moving more than it should in whatever manner, in general terms, we're typically recommending surgery. However, if the spine's structure is good, if it's not moving abnormally, if it's overall a degenerative disc, but not a tremendous amount of arthritis causing the spine to move poorly, that's a huge opportunity to try regenerative medicine treatment options as opposed to needing surgery. And we're seeing amazing results in these patients.
Thank you, Dr. Bharara.
Yeah, and one of the things that Dr. Haines mentioned was a degenerative disc. And the disc is the shock absorber of the spine. And as you age, what happens is you lose the hydration or the water that's within the disc, and the disc gets stiff. And when the disc gets stiff, it starts getting more and more degenerative, and at times that can cause pain. Or you could have a traumatic event where you tear your disc, and that causes pain as well. And what we've seen at the Virginia Spine Institute, we've done hundreds of injections into the disc with regenerative medicine options, and we've had fantastic results with treating that population. So we found that population to be to be able to respond very well to regenerative medicine techniques. But just like Dr. Haines mentioned, there are plenty of different issues that don't lend well to regenerative medicine as well. And Dr. Haines mentioned more severe cases of something called spondylolisthesis, where we see potentially large movements of the spine, and the spine being really unstable. And in that situation, surgery may be the best option. But we've found many different problems and issues in the spine respond very well to different regenerative medicine techniques.
I think it's important to highlight that not all people with painful discs end up needing either surgery or regenerative medicine treatment options. And I'm an example of that. When I was in high school, I was playing soccer. I slipped and fell on a herniated disc, and I had terrible back pain and leg pain. Well, my back pain and leg pain is completely gone now, and it's simply because I was able to do physical therapy, take pills, over-the-counter medications, and with just a little bit of time and keeping my core strong, I have no longer have any pain whatsoever. So it's a rare subset that people end up needing these sorts of treatments, but when people get to the point that all normal non-operative treatments aren't working, these are two very attractive potential treatment options.
For those patients who are in that scenario, what type of questions should they be asking their providers to see if regenerative therapies would be the right solution? What type of tests should they be aware of? Can you speak on that?
Sure. So I think one of the biggest things which we've touched on is in order to know if these treatments are needed, we have to make sure we've done all the other routine non-operative treatments. Sometimes modifying physical therapy, sometimes trying certain injections is really all that's needed in order to get patients back to a 100% pain-free lifestyle. Now, if there is progressive nerve damage or severe instability, as we talked about, where the bones are moving around where they shouldn't, but if someone's having worsening leg pain, worsening sciatica, and we do diagnostic tests that tell us that the nerves are actually worsening as we're watching them, typically those are scenarios where we're recommending doing a surgery, because that takes the pressure off the nerves and stabilizes things to make it a much safer environment for the nerve.
And I agree with all that, and I think it's very important that we're able to find the pain generator. We do not want to treat an MRI, and it's very, very common what you see is you look at an MRI and you see a disc bulge, and you think that's where the problem is coming from. And what we use many of the non-operative treatments is to make a diagnosis. And because when we make a diagnosis, we're able to provide a good treatment option. And that may be a regenerative medicine, or it may be physical therapy, or it may be a surgery. But the most important thing that you do is you truly make a diagnosis and you find where that pain is coming from. Because that always isn't as easy as just looking at an MRI. That may involve doing a nerve test, or they may involve checking the disc integrity. So there's lots of different options that we use to help make that diagnosis. And depending on what the diagnosis is, there's a wide variety of treatments. And regenerative medicine may be one of those options.
Thank you very much. Dr. Bharara, can you speak to any of the innovations in regenerative medicines that are making it easier for patients to perhaps have access or be knowledgeable and feel empowered to make that decision?
So I think regenerative medicine is a newer field, and it's a newer science. And we continue to innovate in the field of regenerative medicine. We initially were doing a lot of platelet-rich plasma, or PRP, which is growth factor injections, and that has gotten very popular because a lot of athletes have gotten it. We have moved into the realm of doing stem cell-based injections from bone marrow. And I think as we continue to do more of these regenerative medicine procedures, we're getting a better idea of what works and what doesn't work, and what problems really do lend well to regenerative medicine and what don't. And potentially are severe cases, there's severe cases not do well with regenerative medicine. We don't always see that. Some very severe cases do very well with regenerative medicine. So I don't, with the innovation in regenerative medicine, we're learning more about who is a good candidate.
That is a great segue into my next question. Who is a good candidate, Dr. Haines, when you're looking at your patients and deciding if that is a treatment option that you would like to provide to them? What type of things do you consider, and what can patients identify with that they might be a candidate for regenerative therapies?
Sure. So kind of pointing on the counterpoint between surgery and regenerative medicine, if it's patients have gotten to that point where we're talking about one option versus the other, the two major things that I look at are, number one is instability, and number two is if there's worsening nerve damage. So by instability, again, I mean scoliosis, meaning a curvature of the spine, or basically when the bones aren't placed in the body's normal position. When the bones are moving around abnormally, oftentimes stabilization, getting the bones to move together with surgery itself, is a better option. Also, if patients are having worsening nerve damage and the nerves themselves, by having prolonged pressure on them, are worsening with time and becoming more unhealthy, those are the two major scenarios where I typically recommend surgery over regenerative medicine.
Do basic demographics like age or gender affect anything?
So initially, we were thinking that as patients aged, as they got older, that they'd have less viable stem cells, less viable growth factors in their body. So initially, the patients we were selecting were in general younger and healthier. Well, as those patients started doing tremendously well, we gradually started opening up our indications, saying, well, try a patient who's a little bit older, who theoretically may not have as many stem cells in their body. Well, then we saw those patients who were doing well. So we went a little bit older, and we saw that those patients were doing well. So currently, for myself, age doesn't play a factor in terms of recommending regenerative medicine or recommending for or against it. Similarly, gender, I haven't seen any differences between men and women, so age and gender are not big factors for me at this point.
Thank you. In closing, I'd just like to ask Dr. Bharara, is there any one main important thing that you'd like to say to the audience today about regenerative medicine?
Well, I think one of the things we need to realize in spinal healthcare is it's not just about regenerative medicine or spine surgery. It's really a large spectrum of treatments. And we don't just use non-operative care or just regenerative medicine or just spine surgery. Many of the times we use these in combination of each other. So it's very important that you discuss all the potential treatment options with your physician, and to really understand where the problem is coming from so you can know what the potential treatment options are.
Thank you very much.